the areas that's really near and dear to us as a result of our men's health event that we hold every year at Ford Field is we look at a lot of statistics. And one of the things that we have found is that not only is there a significant amount of obesity and hypertension in this population, but 62% of the population that attends our men's health event are men of African descent. And there's even a higher incidence of obesity and hypertension in this subgroup of population of individuals. So it gets me into the topic of racial disparities, which I think has been totally under addressed. And I know is one of your focuses, Dr. Powell. And, you know, it's just becoming increasing evident that there's a significant impact of racial disparities on prostate cancer development, disease progression, and disease-specific death. And overall, we think it has an effect on men's health and well-being. So, you know, last year we were fortunate enough to hold a Zoom summit with several leaders in men's health disparities, looking at how we can improve men's health disparities in our community. So I think now that we're so fortunate to have the both of you, I'd like to ask Dr. Powell first a question about how you can elaborate on the genetic, sociocultural, and even intrinsic community health deficiencies that are in existence that play an overall role in our racial disparities. So, you know, I did mention a little bit about my concern about racial disparities. Do you believe that socioculturally that there's a difference in the way men of African descent are actually addressed, treated, handled, managed, counseled, handled through the entire process?
Yeah.
Do you think it's a lack of ability to communicate properly between a patient-doctor relationship? Do you think, what do you really believe is going on?
All those things, Mike, in fact. But we did a study in the early 90s trying to understand the behavior of African Americans as it relates to prostate cancer and other cancers as well. And one of the first things we found was a distrust of the white healthcare system, because many African Americans, not just men, feel that if they go to a hospital or a doctor, they're not going to get the same treatment as white do. They did a study in Philadelphia looking at several hospitals and found that to be true, that African Americans got less care in the health system, particularly hospitals, than whites. Other issues are they're afraid of being experimented on. As you may know, what happened during slavery. I'm reading this book called Medical Apartheid, where it talks about the experimentation that occurred among Blacks, for example, for a vaccination for infections and viral infections. They were tested on the slaves before they were used among whites. You've heard of the Tuskegee experiment. That's just one of them, but there are many other experimentations that occurred. So Blacks are afraid of going to the hospital for that reason. They're afraid of participating in clinical trials for that reason. And now we know that many of them are resistant to getting the vaccine for the COVID virus for that reason.
Absolutely.
So the fear of what's going to happen to them as opposed to what will be good for them is very prevalent in the African American community.
Thank you.